Good afternoon, everybody. Uh, we're starting another podcast, another AETA Talks. The title today is the transition from conventional flush to IVF in beef heifers and AETA certification committee highlights. My name is Ramon Tosta. I'm a DVM and certified practitioner with the AETA. And today, our sponsor is Vetoquinol. Vaticanal has been a huge supporter of the ATA and has been helping us tremendously. Thank you, Vaticanal, for sponsoring this podcast. Today, I will be speaking with Dr. Clay and also with Dr. Looney. And we're going to have Clay and Looney introduce themselves. And please, Clay and Looney.
Charles, go first. You're the
Okay, thanks, Ramon, and thanks everybody from the AETA and particularly Better Canal for supporting us for such a long time in our business. Without those people, we wouldn't be in business, and our producers wouldn't be producing just very few calves. But a little bit about myself. I graduated with my PhD from LSU. Went to my first IETS meeting in 1978. Just thinking about a little bit about the whole business. I did a lot of early work with some of the very beginning ET practitioners in the field. I always thought I was a really young guy, and now I feel like I'm a really old guy. And all these new guys coming up, I try to bring them along some of the history. We're talking about certification. I took the very first certification test AETA ever had for our company. And Granada at that time was the largest ET company in the world. And the certification is done by company, not by individual. And I was scared to death that I was going to fail for the whole company. And it was all oral. I went in there and all these gurus of the industry were asking questions to me, orally about this and that. And one time they asked me a question, and I answered it, and they said, "Well, that's a good answer. Let me write that down." So I was really laughing about, okay, this is really not what I thought it was going to be. But I really enjoyed working there, and basically at Granada is a company, a multifaceted, vertically integrated company way before their time. And then I've worked with several other large companies. And at the end of the day, before I moved to Arkansas, I had our own company there in Bryan, College Station, Texas. But now I basically am working in extension and research. I do a lot of assisted reproductive technology type research, and primarily on the AI side. I do some embryo transfer research, particularly on the recipient side. But my claim to fame is basically working in the industry for so many years and watching this industry change and grow. That's kind of my claim to fame.
Thank you so much, Charles. Now let's change for Dr. Breiner. Um, Clay, the floor is yours.
So Ramon, first off, thanks for starting this. Thanks for getting what I believe is the podcast title AETA Talks. Is that right?
Yeah.
So thanks for making that happen. I think this is going to be, I know a ton of these practitioners driving around the countryside listen to podcasts, and I think us having a footprint in that is amazing. So thanks for connecting the dots. Thanks for making that happen. Dr. Looney says he's old. I feel old. I've been in this industry for now 22 years. I was in vet school when a guy by the name of Charles Looney came to Kansas to transfer embryos, and everybody wanted to know who this guy was. And so it's been a blessing for me to be a part of this industry and get to be a part of and meet these icons, these guys that started the industry when they were still learning. So I was blessed to get to go to work for one with Dr. Gray at Cross Country Genetics. I've been there for 22 years. Been traveling the Midwest doing ET ever since, and it's been great. It's been the best part of my life besides my family. I'm married, have 2 kids, and it's a perfect way for me to spend 22 years. So thanks for starting this talk. We're excited to be a part of it.
Well, thank you, Clay. Let's also give you credit for that because I remember like last year at the AETA, we started this conversation, and then you and I, we just basically chat about it. Of course, the inspiration of this was the ABP podcast. I always, when I'm traveling, I listen to those guys, and they do an excellent job. Talking about cows, and then that's why we're here, right? And then, but we're more specific than that. We want to talk a little bit more about embryo transfers, and we want to know how to, make more pregnancies and make more embryos, and that's all what we're in here in this for. But both of you, I have tremendous respect and admiration for both of your guys' work. When we were discussing who would have been this podcast, uh, Dr. Demetrio and a couple of other guys, they were suggesting for you guys to come on this podcast, and I was like, great, no, I'm sold. Those guys will do a great job, and we basically wanted to start with like the highlights on the AETA certification, and the first question, Clay, will be for you. But Charles, please jump in whenever you feel the need. I would like to know if you guys could explain to me um, what's how the certification committee works.
So the committee is set up of a group of practitioners that are certified, but basically we're just volunteers that are AETA members that are trying to help maintain this program. That was an amazing program, started back in 1985. Charles, I had no idea you took the first test. I think that's amazing. You should be the one. You should be the one talking about this, not me. But it's a great program. It was initially trying to help us have a stronger foothold with USDA APHIS and be able to show them that practitioners that are AETA members that have achieved this recognition are doing the best job possible to produce embryos that can be exported to foreign countries. And this allowed us to have a platform to test people, to set some baselines, or to set some goals for where our association can end up and try to achieve from that standpoint of producing embryos that are safe and exportable. And it has grown tremendously since then. Now a lot of the certified members do more than export. They're obviously doing more than export, but it's looked at by producers as kind of the icon for the AETA industry, or the ET industry, and the AETA members. It sets you apart from other people by the fact that you've done these things. You've passed the test, you meet minimum standards, you're inspected yearly, and different things like that. So the committee just tries to make sure that all of that happens and communicates that with USDA APHIS. But the program itself has just grown and went from a few members to close to 200 now, and it's been fun to be a part of the committee and help to try to continue to make it better.
A lot of the big producers.
And Charles, sorry, and you mentioned that when you started, the certification was done by companies, right?
That's right. It's changed over time. I mean, there was quite a bit of a lot of diversity in the early business. I mean, this industry has kind of recreated itself, because in the early days, it looked like there's a lot of big companies are involved. Granada was one, Rio Vista was one, and now it seems like it's back to the big companies again. So I wonder if in the future, well, the IVF technology moved to a more smaller module than what these bigger modules are now. But yeah, I mean, I was one of the very first ones that took the certification test for the company. But in those days, we voted as a company too. So how many embryos you transferred, you got a chance to, basically pack the court, so to speak, because we had so many votes. And I remember, I mean, I had the ballots in my hand. I had to write all these ballots out. But I think it's a lot better now because it's individual oriented. And we use the certification in our companies and to help me train the people. All the veterinarians took the certification test within the company, and we had a test file. Nobody really knew that, but we had this test file. I'd write down all the questions that I remember, and it just kept growing and growing and growing. And then we started letting our technicians, take the test so that they could learn about our industry. It worked out really good. I mean, our producers now sell embryos with a guarantee that if you're a certified member puts them in, they'll guarantee a pregnancy rate on those embryos, which is, I've had so many people ask me, hey, I bought these embryos from so-and-so and they need to be put in by a certified member. Are you certified? I said, yeah, I'm proud to be certified since the very beginning. So, I mean, it helps us standardize in the industry and improves on our training and our program. So certification is more than just export. That's basically how I was developed, but now it's becoming, more encompassing. So I'm proud to be certified. Been that way
Oh,
from the
that's
beginning.
really good to hear. That's really good to hear. And I a little bit of like, of the way I got certified too. I got certified by Dr. Moline in Wisconsin. And then like, I remember like, as soon as I got my license here, I took the test and everything, but like I was really proud as well of being certified. It's a really good feeling, and then you can do so much, and kind of shows everybody what you're capable of doing. And so, but speaking of that, who tell me? I want you guys to let me know that, like, I know the answer, but like maybe our audience they don't know that, and even the students and PhD students and veterinarians, who's eligible to become certified?
Yeah, PhDs and DVMs are eligible, but there's a criteria that, before you take the test, you have to have done so many procedures to basically qualify you to go into the testing procedure. What is the numbers, Clay? Because I don't recall the numbers.
You got to collect 50 collections, either 25 OPUs, 25 collections, or 50 total collections. You got to handle 250 embryos, of which 100 of them you would freeze, 100 of them you would transfer. So there's a little flex there on how you do it, but yes, it requires you to have some minimal skill present, plus the knowledge base behind it, which to me is the hard part. Going back to the oral final that you would have taken, like, and the amount of data or information that you had to go through to talk about, whether it was freezing embryos, whether it's super ovulation process. It's a pretty in-depth exam. Plus we've added a lab portion to it. So they have to search, they have to identify embryos, they have to be able to load them into straws. All of it is just trying to ensure that everybody can do the things necessary to make a product good enough for export, a product good enough for a client in the States or whoever.
And the small room that got added, like, right now in the exam as well, right?
Right. So that was the one thing you asked initially, like what's new and upcoming in the certification program. And that's that has changed the most in the last year. We've added the small ruminant portion that was kind of requested, come to us from USDA APHIS, because there was starting to be some small ruminant embryos being exported. And they wanted to be able to ensure that it was being handled the same way. So we added that part to the test. We've added questions and things associated with that. We brought on members that are able to go do the inspection and ask the appropriate questions and know the appropriate answers, so that it is a viable thing for us to be able to put a foothold on and try to make sure that when small ruminant embryos are exported, we can stand behind them similarly to bovine. So that was a big accomplishment for us in the last year.
One of the
What's
big things about I'm sorry, Ramon.
No, go ahead, Charles.
One of the big things, and probably the ancillary things that certification has allowed us to work in the industry here in the United States, is the labeling. Because at the beginning of time, labeling of embryos was pathetic. And it got to a point, where, embryos in commerce, if somebody sent me embryos and I couldn't figure it out, and the customers never have paperwork. So we had to go through a whole learning curve on labeling. So I think one of the big things that certification helped us is standardize that labeling. So now, I mean, it's simple. I hardly ever get any embryos that are not properly labeled. So one big thing that's helped us with certification in our industry.
That's great. And then Clay, the small ruminants also got the same standard of labeling, like Charles was mentioning as well.
Yeah. So, and I think that as industries evolve and continue to grow, we've seen that improvement. And the small ruminant side, I think, would be maybe what Charles was talking about back in the day. Like, they typically will not provide as much information as the bovine side would, and to become certified, they will have to do that. So we can't change the ones that aren't certified, but if you raise the bar, you hope that the rest of the industry continues to raise the bar too.
Awesome. No, that's good to know. And for the both of you guys have had like interns, and Charles like teaches like at the University of Arkansas, and then like we how do you guys encourage like the new generation to get certified? How can they get experience and get their feet wet, and how to get the numbers prior to become certified?
I think certification kind of separates the men from the boys in a sense. I mean, it puts you in a professional state that, shows that you're qualified and you have a commitment to the industry when you're certified. That's a big deal. You're not out there, you're basically, going to these meetings, you're keeping your CE credits up, your continuing education is important. So I think that's a big plus when you show up at a new customer's place and you tell them about, what you can offer. So I mean, certification is it's easy for me to tell these new guys that's something you need to do. I mean, it's plenty important, not only just for export, but for all aspects of the industry.
You guys kind of already like answered the next question, which was about like what are the biggest advantages, of being certified. But if you guys want to explore a little bit on that, that would be great.
I think mainly, I mean, the very first aspect of it is able to export embryos, which not everybody will export embryos, but no matter how long you've been in this industry, is one of your clients are going to sell some embryos overseas. So you're going to have to, it's a peer pressure type deal for you to be able to take care of those embryos for these customers. So export was by far the impetus to start getting certification. And then just the learning process and the professionalism with the certification is important.
Well, that's great. And becoming a practitioner, like, and being certified, like you said, is a, stamp on our resume, and means a lot to us. And then like, it's a real deal, like you said. Um, any final consideration, guys, about like the certification committee and the highlights? Because next topic here, we're going to switch gears to something else. Clay, I'll go back to you.
Okay.
And we're gonna talk here mostly about like the transition that our industry has been like mostly seen on the most of the beef industry. That's what we're going to talk about today. Switching from like in vivo embryos being transferred and produced to in vitro, and then how many like in vitro embryos we've been like seeing and observing today being transferred. And Clay, I would like you to tell us how does your practice work and how many beef cows and heifers you use to flush compared to the amount you have been like doing OPUs on right now?
Yeah, so good question. I think that this is, continuing to be something we always talk about, just like Charles said, labeling was back in the day or still is today. But, we're probably still the one company that does a lot of conventional ET. 10 years ago, we would have been a company that did 100% conventional ET. 5 years ago, we would have been 90% conventional, 10% IVF. And I think as we get to this year, obviously, just like everything else, IVF is continuing to grow. I would guess we're going to be 75% conventional ET, 25% IVF. I think that everybody knows why that happens. Once you start doing IVF, it lets you have some things that you can't do conventionally, right? You can aspirate pregnant cows, you can aspirate them more often, you can make more embryos. All of those things are good, but in general, our clients still need KEVs. They need babies that they can sell. And so although our IVF is growing and our conventional is staying pretty much the same, we still if you make so many embryos and you don't get them in, they really don't help our clients. So at some point, we've passed the threshold for us to be able to make more KEVs. And I don't know, I think our clients somewhat see that. They want to stay current. And we're still doing quite a bit of conventional work, even though our IVF continues to grow.
Yeah, this
And
industry has changed over the years. I mean, when we first started in vitro fertilization work, it was modeled after the human work. And we started just like most all reproductive technologies that we have worked with. We start with problem cows because I don't know what it is about reproduction, but particularly in cows, any new technology, the producers allow us to work on cows that's going to be a problem. So we basically, our very first work that's been published worked on problem cows. So that's how we got started. And lo and behold, we made pregnancies on every cow that there was enrolled in this program because of the technology separated ourselves from the problems with the uterus, the problems with the oviduct, going in and cannulating the uterus. There's a lot of reasons why we're able to do that. But we started at the infant stages, and now, I mean, we knew that the technology would take off into the healthy cows, but it started in Brazil before it started in the United States, and the Brazilians would come and our first probe that we used was developed using a broomstick because we didn't know how long it was going to be. So I had to use a broomstick as a dipstick to figure out how long this probe is going to be. And then we had to go to Cook in Australia to come up with a needle system that we could use in a cow that's 18 or 19, centimeters long. There's a lot of, all started. So, I mean, it's obvious that we knew that it was going to go into the healthy cows, but by far the great advantages of IVF technology is come about because of being able to reverse sort sperm and use that into an IVF system. That's these guys always knew that there's certain bulls make really good heifers but they didn't make really good bulls. So they really wanted to take that technology, and that's how I got started. And then when they figured out that they could do it on a pregnant cow, that was like 1+1 = 3. So then that's how this whole deal started, really. And it's kind of like a big bowling ball started rolling. It got bigger and bigger and bigger. And so yeah, I mean, in a way, it is. I'm proud to be able to see the technology move, but I understand too what Clay is talking about, because every time you stack these technologies on top of each other, you lose efficiency. And the farmer is the one that's paying us. So they have to have something to sell. And, reproduction is not very heritable, but it's probably the most important aspect of all our business. Because if they don't have something to sell and a calf, they're not going to make it. So I understand where he's coming from with a conventional sense. And it's getting better, but it's probably $75 million spent on a yearly basis if you could culminate all the research trying to get to that point where we were with embryos. But just remember where we were when we first tried to freeze an embryo. We were with DMSO. We were doing all kind of stuff. We had glass ampules. So, technology will get better as time goes on. Plus,
And do you guys think that, like, going back to what the both of you guys said, and I observed a little bit of both. So, on the beef, of course, the dairy industry is completely different than ours. But like, on the beef industry, do you guys think that like this transition is happening kind of a slower, mainly because of what?
Because our producers don't adopt technology very fast. They're very, very slow to I mean, a dairy guy is more like a row crop farmer. These guys, they see these cows every day. It's, they're milking, their measurements, they're more objective. Our beef guys are more, they're not, I'm not saying they're not casual producers, but the objectiveness of beef cattle is a lot different than because we got segmentation in our business. Some guys sell only calves. Some guys, they sell everything in the meat. There's just all kinds of different industry. So it's a lot different. It's mainly the objectivity of the business and where we're slow to adopt because of that. It's going to be like that for a while.
Yeah. And go ahead, Clay.
I think on our side, Ramon, a lot of our clients still sell both genders. Like they have female sales, they have bull sales. And in the dairy world, correct me if I'm wrong, you're really trying to make either elite ones or one gender. So the controlling gender in the dairy world is maybe more important than some of our clients see it. So we still do a lot of conventional and those clients where they're okay making both. Where we've seen IVF work the best for us is like Charles said, if we need to reverse sort, we can control gender on anything now. And with the conventional side of things, you're limited to certain bulls that they make sorted semen on and or sorted semen that works well. And so that is kind of been a big thing for us. Plus, as the beef industry in our world has started to move to a younger donor population, like the dairy, that's where we've seen IVF increase more. Charles and I talked a little bit about this today, that there is probably some benefit to IVF in that younger population. And as the beef industry continues to drive their donor population into being younger animals because of different, genomic stats or different things like that, then I see IVF in the beef industry catching up. Don't you think, Charles?
And I'm just gonna add a question already to the subject you brought up right now. And what are the biggest challenges you see with IVF on those younger heifers, and how early can they be collected, and what is the impact on breeding them back?
Well, no question that the embryo production increases as the age increases in these heifers. And that's typical true with the conventional flushing too. The big crux of the matter in heifers is the production of embryos. And every time somebody wants to flush a heifer, I'm saying, okay, let me just tell you exactly where we're going to be at the end. And so it's always been somewhat reduced until they reach that threshold of age. And I have to say, we have collected embryos out of 3 and 4 year old heiferettes, and because our producers really wanted more embryo production than they wanted pregnancies out of that donor. They wanted us to make them as fast as we could because the genetic value is much greater in these young animals. So it's just checking the generation interval. But IVF, it blows us out of the water as far as being able to produce from a heifer. I can't stress more than anything about an IVF allows us to get this heifer bred and let her calf in time, like on her 2-year-old basis, and we still can produce embryos. In the olden days, we had to wait. We got these heifers puberal to flush them, and then at the day we get maybe a couple flushes out of them, and it never really stellar, but then we got to get them bred back, and then some of those heifers never got bred back, and that was really a pain for us after we did all that work, because the conventional flushing, you got to cannulate the uterus, so you have problems with there. You got to superovulate them. You got problems in that regard. So there's lots of different ways, you separate that with IVF. So it's no question an advantage, but I don't know.
And Charles, the way you see it, you had bigger problems like breeding back beef heifers you had flushed, or beef heifers that you had aspirated.
Yeah, flushed, because by the time we got the embryos out of them, they're already too old and probably obese. So we had trouble getting them bred back. You got to manage them a lot better. I'm sure Kirk and them managed those heifers better than what we did in the early days. But it seemed like they got to a point where they got 3 years old, couldn't get them bred back. There's a percentage of them that was always going to be open anyway, but it's one of those issues where you need to, at the end of the day, they need to get them pregnant and to get them marketed in the business.
A question here for the both of us. What's the youngest beef heifer you guys have ever aspirated?
We aspirated some at 11 months of age and produced some embryos that didn't make pregnancies. We're trying to stay 14 plus. That's where we're trying to stay within a breeding season.
They did a lot of work. Richard Fry in Australia did a lot of work with laparoscopy in heifers, and and when I was at Transova, we produced pregnancies, from a heifer that was, like 3 months. So, but we did it by laparoscopy. So it's one of those, I don't know. I mean, by far, younger, they don't work as well. They get older, they seem to work better. There's lots of data on that regard.
And sorry, Charles, but where do you guys see? I would say that like the biggest advantage on the aspirin that early would have been mostly for the producers that are dealing mostly with genomic heifers. Is that correct?
No question.
And do you guys see that how far are we pushing the bar right now when it comes down to aspirating those young heifers for those genomic producers?
As far as age, or as far as how you increase the values?
As far as age and embryo production, how much are they trying to push you guys to basically say, hey, yeah, I mean, I have extremely highly genomic heifers, and we need to make embryos out of them. So how do you guys respond to that?
I think it's more in the dairy industry than it is in the beef industry, even though there's some special matings, unique matings that are come about that they're wanting to get embryos out of early on. But we're not talking about a huge number. So if they can get a few pregnancies that they can offer them in a particular sale, it's kind of a special lot. I think I think they'll be satisfied with that. But I don't know.
Ramon, I think the generation interval isn't quite as fast in the beef industry as you guys have to deal with in the dairy. So we're still utilizing that year or 15-month-old heifer, whereas you guys think that's way old, just because at 6 months, 8 months of age, she may start losing her value, right? Just because the genetic turnover is so fast. And in the beef world, I don't see it. It may get there, but I don't see it being that fast. And somebody still wants to sell that cow, that donor, that female. Whereas in the dairy world, once you make the next one, aren't you just trying to make the next one after that? And at some point, is the donor, where's the value? Is the value in the donor, or is the value in the offspring? I think in the beef world, they still look at the value as being in the donor.
Got it. No, that's great. That's great that you say that. And do you see like on the IVF work you guys are doing, is there any, I know you guys are mostly like, in areas where like it's mostly beef, but like do you see any of your customers like trying to make embryos or genetics towards like a beef on dairy? Is there anything like that for you guys happening?
We're, we're having some where we're trying to get more beef embryos into dairies, but it's more like a recipient herd, cooperator herd. It's not. So it's adding some value to sell that solid beef kef out of there, but it's not really making him, well, it's adding value, right? So we're seeing some added value occurring in Western Kansas dairies based on that.
No, that's good. Clay, one question that I think I asked, but like I don't know if I understood it correctly. Like, after you said you started aspirating your heifers like around 14, 13 months of age, most of the time that you guys do. How hard have you guys, been having trouble or something like that with bringing them back? I know Charles mentioned that like flush heifers, they get obese and they get like, a little out of hand, but like on the IVF side, is there any trouble you guys are getting there?
I mean, not all heifers breed, that's for sure, but I do feel like Charles is probably correct. If you conventionally collect a cow multiple times, our chances of her not carrying a calf is higher than if we aspirate that same heifer a few times. We have two different client bases. It seems like one doesn't want the risk, so we start with the pregnant heifer, and we make all these IVF embryos that are either frozen or calving at the end of the season. Now we've kind of got some of our clients convinced where we're breeding and then aspirating and then checking return heats and breeding and then aspirating and trying to have her kev in the middle of when all of her ET kevs are being born. And I think to me that makes the most sense, because now your ET kevs are being born in the middle or at the beginning of a calving season. And in the beef industry, that's important. Age matters, size matters, and all of that means that you have more chances to have a bull make a production sale. And so we're doing both. And I think every now and then you have to stop aspirating a cow or a heifer and just try to get her bred. But a lot of times she gets pregnant while you're doing it, and it's kind of amazing.
And how much of the seasonality of I know there's like in the beef industry there's a big seasonality like where you guys will avoid the summer for sure. And is there any advantage of like doing aspirating beef donors? Do you guys tend to aspirate donors during the summer? How does that work for you guys?
Well, if you're working with Boston Indicus, the spring longer day length season's better than than in the fall. But you know, it's these cattle are not seasonal, so you basically can work anywhere. We did studies early on and looked at seasonality, and really we didn't find hardly any difference at all. It's just in the spring, particularly in the Gulf Coast areas, we we typically have more spring breeders because of the forage availability than the fall. But everybody, and it's kind of funny because everybody is a spring breeder, and all the calves come off and wean in October, and that's a big glut of the market. So the fall season seems like we get a higher price for them, but you know, I don't know. It's just seasonality is not a really big deal, but you know, it's not like in the dairy business where you breed them year round. We have a fall season and a spring season.
Going
And
to
we have freezing embryos during that time because as practitioners, we still can produce embryos and freeze them and then put them in during those peak calving seasons.
Yeah, I mean the I would say like just on my experience like with beef, like the main thing with me is that like doing IVF and aspirations, like most of our clients, they stop in the summer, and then they go back in the fall, like you're saying. And there's a seasonality there. I mean, but like IVF allows us to go year round, and like sometimes we know that all sites do get stressed like during warmer months, and that can be a problem. But I'm going to switch gears here a little bit, Charles, and I'm going to ask you like something that you touched on a little bit before, but how do you've seen the industry evolve, and you've seen how the IVF now it's taking its place in the market. How do you see cattlemen accepting this new reality of IVF in beef cows and in beef heifers?
Yeah, I think there's no question that the cattlemen realize this technology is here to stay. Uh, they they spend a lot of time at the coffee shop talking about it. You know, the terminology has been a problem because in the early days of conventional embryo collection, they would call it flushing, and I never liked that word. I was there at Granada when some of my friends come from Mount Pleasant, Texas, and they were watching us do this embryo collection. And they said, "Well, all you doing is flushing." I said, "No, you flush a toilet. You you collect embryos. This is not flushing." Now in the IVF business, they call it flushing too. I said, "No, wait a minute. There's two things. We gotta separate this terminology." But they've accepted it, and they also realize we're going to produce more embryos, but the pregnancy rates and are lower, and the embryonic mortality is higher. And the most expensive part of ranching, particularly with embryo transfers, is recipients and managing those dang gum recipients, and that's very expensive. So we got to keep our eye on the ball and make sure that we can keep that process improving, because that's what's costing these guys a huge amount of money. Yeah, we can produce more embryos and they can sell them to their friends, but we got to put calves on the ground too, and that's where we need to put our efforts and our research. It's probably because of the oocyte at the beginning of the whole process. That's probably the weak link in this deal, but time will tell, and everybody just stay patient because it makes it's
And
gonna,
how do you compare like how IVF members were back then and how they are now? You touch on the subject of abortion, like I think that's a huge one. That's why sometimes people opt to stay and stick with conventional embryos. Um, how do you see that?
uh that is the big elephant in the room with the process. It's and I explained to them at the beginning, there's those issues. They're pretty enthralled to jumping ship and getting into IVF because of the great advantages, more embryo production. I can list all the advantages and they know it. But I try to make sure that, hey, listen, we still do have a little bit of large offspring syndrome problem too. So be aware. I mean, not everything is going to be a perfect panacea in this new technology. Again, I tell them as we stack technologies on top of each other, we still have some efficiency problems.
Wait, do you see that as well?
As far as the problems associated with IVF,
Yes.
I think it is out there. I think it is so much reduced compared to history, and it is there. Large offspring syndrome. We talk about it at almost every meeting now. Increase losses at each stage of gestation. It's higher in ET-KEVs. It's probably higher in IVF. And we're always just trying to compare it to El Natural, right? And so every time, like Charles keeps saying, every time we add assisted reproductive procedures to it, we probably create some situations that we don't know are there that cause fetuses, embryos to go away. And yeah, it's there. I think it is less than it used to be, and I hope 10 years from now we'll say the same thing, right? We just keep trying to make it better.
And
No, at the
Clay,
beginning,
go ahead, Charles.
I said at the beginning, we cultured these embryos like the kitchen sink. We threw everything at them. We had high levels of serum. We put them on the monolayer fibroblast. We had all these growth promoters. We didn't know how to culture embryos. All we knew how to culture was cells in the lab. So we put them together. So we created some of the problems at the beginning. Now we're starting to wean ourselves off of those and are having more defined culture systems, which by far have improved. I still have nightmares with some of the first IVF calves we produced because of those problems and to seeing the look on these producers' eyes when we pull a 180-pound calf out of the side of a recipient. So, I mean, yeah, we're much better right now. And if it's 1 in 1,000, even if it's that low, we've made major improvements.
And most of the time, let me ask you both this: why most of the time your clients will opt to do IVF instead of conventional flush nowadays?
That's probably reverse sorting and being able to produce embryos when they're gestating a fetus. And they can do them with younger animals. They can do them short postpartum animals. I mean, and the fact is now they can do it without any stimulation at all. They can bring the cow out of the pasture on the day of the aspiration and make embryos, and where it's been, at least a 30-day protocol with a lot of, tedious type work in the other way. So, I mean, it's simpler. It's probably more expensive in the long run, but it's simpler.
No, that's good. That's good to hear. I mean, Charles brings such an experience and background to this whole podcast because, like, I was talking to Clay about this, that like he'll bring like a bunch of like um, history and then like how the whole thing like came together and like to learn how we did it back in the day and how we're doing right now. We can see that we're much better, but I believe we still have like a long ways to go. And one of the questions that always comes up in every AETA meeting, at least that I'm talking to people. Do you guys, what's the biggest challenge when you're talking to your clients about like when to decide, are we using FSH and why are we doing that, or we're not using FSH?
Man, I tell you, this has been a really tough one for me because I've always been on the FSH side. The first studies we did always proved that it was a benefit. But as time goes on, I've been listening to my Brazilian friends, and I've seen some ovaries unstimulated produce 30s and 40 oocyte numbers with high production rates. So I'm like, maybe I don't understand everything. So in science, sometimes you need to keep good records so that you might find out something more. We always thought that bigger follicles make more competent oocytes, make more embryos. But I mean, I don't know. It's something that we still got to look at. Uh,
Because the research that was presented, like, I believe by Dr. Alvaro from the University of Ohio, he showed, the FSH was more beneficial, producer more embryos, and then like there was a bunch of studies showing that, and that's always like you said, Charles, what everybody has been used to. But yeah, I mean, there's also the other side of the coin where, like, people are seeing like like for instance, Bosinica's cattle. Um, they will produce because they have way more pool of oocytes. They will produce embryos with no stimulation. Clay, what do you see on that topic?
Yeah, like Charles, we're predominantly all FSH in our IVF program. Just the data up till now, I think, has always said that. Our clients are used to giving FSH shots. I've never really seen anything in repro actually get better by doing it easier. So I don't know. I've never been on the let's just do it the easy way bandwagon. I've always been the old fashioned, got to work for it, and it seems to work out. So maybe I'll change, but as of right now, we give FSH. We think it helps us, and most of our clients follow suit.
I
Yeah,
remember Dr. Assad will tell me, we talked about follicle size and stimulation, and he says, hey, it's a no-brainer. The follicle needs FSH to grow. The follicle produces a more competent oocyte when it's growing. So I mean, I remember him telling me that, and I said, well, the data reflects that, but it's and it probably wouldn't even be talking about that if we were still using FSHP at $10 a vial, but we're not. So
but Charles, I mean, the data that I've seen that, like, of course, FSH is great and then helps a lot on the comparison with like follicles of 7 to 10 millimeters, uh, correlating with bigger amounts of like a blastocyst. Um, when I see data like that, and on my own reality, when I'm aspirating beef cows, I see the higher production of embryos too. I do tend to believe that that's the way to go, like Clay said. And I do also have the tendency to observe more that, like Clay also stated, the when you synchronize that cow, when you don't have a dominant follicle to start with, you do a DFR or GnRH right at the beginning. Um, that always helps us. Uh, how important it is, like, to have a synchronized cow with a not a dominant follicle when you're doing your super stimulation. How important do you think it is?
for for conventional or for IVF?
For IVF. For conventional, we know we can't get away without it, but like, but for IVF.
Yeah, I have gone and thought about this a lot because we always bring in this coasting factor, you know, but how does that coasting factor work when you don't stimulate the cow? And I mean, I don't know. Maybe because I'm getting older, I think about different ways, but uh, I'm thinking about unstimulated cows. It's random, so we don't know where they're at, but they're still producing embryos, and and the good numbers. I mean, it's not zero, but you probably get higher variability without stimulation. But
Yeah, I see that as well. And then like, but I was trying to say, Charles, is like mostly like when you're setting up your cows, when like, you remove that dominant follicle, um, if you don't do that, and then sometimes I do get some clients that basically like, hey, I forgot to give GnRH. And then they start the FSH anyways. Do you see issues with that, or how often do you see also that your GnRH doesn't work? What's your opinion on that?
I don't have much to say about that. I know it works because at the beginning of the time we didn't have follicular control, and we were just shooting in the dark, starting the cow at the middle of her cycle. Hopefully we're gonna catch away, but seems like the FSH overpowers the system, and you start getting follicular development. I mean, I used to inject FSH into terminal cows that we're finna remove their ovaries, and I know we didn't do any follicular control on them. We just started hitting them with FSH. It overpowers the system. We get some follicular growth, and it's not all just one dominant follicle. So I don't know.
Clay, question for you. On your system, when do you recommend to your client when you're flushing like cows? Like when do you stop and recommend to your client like now it's time to go into IVF?
Most of the time they're picking that based on what their goals are. They want to control gender or if they want her bred. We have a lot of clients that will start conventional, they'll breed them, and then we'll aspirate them for a while to produce some extra embryos. But we didn't used to see any crossover. It was certain cows they aspirated, certain cows they collected conventionally, and now I do feel like we get more crossover. We get more clients that are doing both. But I don't know if there's just one thing that drives them to switch. I think it's usually they either want them pregnant and then they want to make some more embryos, or for the most part in our world, it's starting with the younger animals and getting more chances at heifers during a breeding season than just one and try to get her bred. So that's that, and controlling gender. Back to your question to Charles about the GnRH. We used to always start our FSH programs off with either a DFR or GnRH. And I think over the course of time, we've relaxed a little bit on that, but maintained the need to give FSH. So in my belief is FSH is more important than controlling that wave exactly. But I also feel like if we didn't give FSH, we would want to control that wave more exactly. So if we were pulling FSH out, I would definitely recommend that we're starting them on GnRH 48, 60 hours before OPU, trying to get some timeline there of where we know that wave is going to be. But a lot of our heifers that are pregnant, we're not starting with GnRH. We're just giving FSH. We're trying to reduce the number of potential CLs that are going to be present on that ovary.
And you mentioned, I don't know if I read here, but like in our previous conversation, you were mentioning like the amounts of FSH we're giving on heifers versus cows. What's your guys' recommendations on that?
Yeah, we're definitely less. I think most of the time on heifers, we're 4 shots getting 6 mils, 6 to 8 mils. On cows, we maybe give 8 to 10 mils FSH, which is, maybe half of what we would use conventionally in that population. Like heifers are usually getting 10 to 12 mils conventionally, and they're getting 6 to 8 in IVF, and cows are usually getting 14 to 16 mils of FSH conventionally, and we're utilizing 8 to 10 on IVF programs.
And
So
when
does
you
that mean, I'm sorry,
let me just finish one here, pretty quick, Charles. Clay, another thing we want to know, like, is like Do you tend to adjust your shots, like your levels of FSH based on response, or how do you troubleshoot that?
I think that's a great question. In conventional, yeah, we chase doses, but I feel like we're less apt to chase doses in IVF. Now, over time, if she doesn't stimulate much, yeah, everybody's trying to make more, right? So we're going to give her more FSH, but for the most part, we're pretty consistent, same dosage scheme based on what they are, a heifer or a cow in IVF.
I almost thought that initially that we couldn't overstimulate an IVF donor. I've kind of backed off a little bit in that regard. I mean, for sure, in fact, you can overstimulate a conventional donor uh, pretty easily with the increased dose. But there's a lot of FSH given to IVF cases, and you don't see that classical fertilization failure as we saw with the conventional flushing. I think it has to do with high progesterone at the time of estrus causing the failure. But I don't know. It's a really interesting. There's a couple of papers I just reviewed uh, about giving too much FSH to an IVF case, and there's a lot of work in the human area that way too. So it's still, I don't know what's going to happen with recombinant FSHs, and what about anti-inhibin? What could we develop an anti-inhibin to do this, to let a cow supra cell or stimulator cell? There's a lot of things we could do. We need to kind of dust off some of the old research and see what we might be able to conjure up.
And talking about a little more on the research side, like, and then do you? I mean, we notoriously we know that like the pregnant cows and the pregnant heifers they do better. Yeah. Any comments on like providing to the open cows and open heifers like an external source of progesterone?
Yeah, I think it's important. I think it needs to be. I think it needs to be done now. There's some companies will add a cedar during stimulation. I hated to put a cedar in a cow that I'm going to do a transvaginal aspiration on. So I mean, a source of progesterone may be injectable, or maybe a ear implant might be useful.
Yeah, that helps a lot. We we like to think that like progesterone will increase the quality of that oocyte and will make that more viable, but there's like some different opinions on that. And Clay, do you guys do anything like that on supplying progesterone?
We've kind of went opposite on that too. We started always having cedars in, always controlling follicular waves, and we've got away from now. We don't ever put cedars in, and we give less GnRH than we used to. So I don't know. I don't know if that's a dairy thing more just because of the high metabolism and that dairy cow needing that or burning through that progesterone faster than what the average beef cow is doing, but we are less apt to worry about progesterone today for sure than we used to be.
Yeah, because what worries me the most is when like you have like a certain amount of FSH and it's being really high without a progesterone source, and then you see like that cow showing some signs of estrus, and to me that's when the oocytes basically like start like not turning out to be as great for fertilization. That kind of throws a wrench in the whole process, but um well, we're getting like, I guess, over past our time here, but like I want to hear from both of you guys. What's your final considerations on, of course, I want to thank Vero Canal here for the support and always we talk about FSH all the time. Vero Canal has Photropin, and we've been using that for years, and that's great product, and we like to thank them for the sponsorship and always to be supporting ATA. But I wanted to hear from you guys your final considerations on this. Uh, I would say the early stages of like we're not as fast going as the dairy industry, but we're in the early stages of like a transitioning more like into IVF instead of flushes. And what do you guys think? And just like to give your final thoughts for us, for our audience as well.
Well, I could say that IVF is here to stay, and it's already commanding production roles in our industry. There's still it's still like totally cooked. We're still a little raw. We are making tremendous headways. I mean, no question that there's great advantages of using this technology overall, and if you don't adopt it, you may be left out. So everybody kind of had to hold each other's hands because the technology is here to stay. There's no question.
Yeah, I agree. It's going to be something that's continued to be used in the beef industry, and as you've shown, there are more IVF embryos in the beef industry transferred than there are conventional embryos, and I'm sure that's going to continue to adjust and grow, and our goal is to just work with our clients, try to sit down with them, figure out what they need, and utilize the service that best accomplishes that. And I think that's everybody that's an AETA member. It's fun to go to the meetings. It's fun to meet you, Ramon, and just see how everybody finds their little spot, finds how they can fit into a industry somewhere and be significant, and see an industry continue to grow from when Charles took the first exam back when they chipped it onto stone tablets to today. We're fully electronic now. Like, we're taking tests and giving them results next day. So it's amazing what the industry's done.
Now, that's great to hear from you guys. That's great to hear from you guys. And then, I thank both of you for your wisdom, your experience. I'm sure that a bunch of the young practitioners, they're or even because I've been practicing for 10 years, but guys that are just getting out of vet school right now and want to become certified, they're listening to you guys. You're grasping on all that wisdom and then all the histories and stories that Charles is telling us about how it started. So I'm sure they're gonna go back to this podcast one day. They're gonna say, "Hey, I listened to that podcast. I remember Charles saying that he was the very first one taking the exam." So that would be fun. That would be fun in a couple of years to hear people saying that. Guys, thank you so much. It was great. Again, thank you, Vaticanal, for sponsoring us and then for helping us. And I'll see you guys, soon. And if not, the ATA meeting, we will be there in Canada. Again, making sure that everybody goes to Canada and have a good time there. Thank you so much, and you guys have a great evening. Bye bye.